Well, as of Wednesday, the CDC confirmed more than 13,000 monkeypox cases around the nation. As of yesterday, the Colorado Department of Health said there are 168 confirmed here in Colorado, and the case rate has been trending upwards. So with cases going up and more people looking for the vaccine, Scott Bookman with the State Health Department says monkeypox vaccination supply from the federal government is pretty limited right now, but the state is hopeful that more will be delivered in the coming weeks and months. Joining us now to talk more about that is our 9 Health expert, Dr. Payal Kohli. Good morning.
Good morning,
Good
Gary.
to see you.
You too.
So the government is taking steps to increase the monkeypox vaccine, but it's going really slow, isn't it?
Yeah, it's been a real challenge. In fact, there's many Coloradans who are on a wait list or just getting 1 dose instead of getting 2 doses. But the government is trying. So as you know, the vaccine is actually manufactured abroad. It's made in Denmark. So they've talked to the Denmark manufacturer, asked them to make more vaccines. But we've also changed the way that we're administering the vaccines. So we used to be giving a 0.5 ml dose subcutaneously or under the skin.
Okay.
What we realized is that we can give 1/5 of that dose, 0.1, into the skin, deep into the skin or intradermal. So 1 vial can now vaccinate 5 people.
And so given that it's such a short supply, who should be going to get these vaccinations?
You know, more people than you would think. So
Yeah.
if you're high risk for exposure to monkeypox, or if you've already been exposed to monkeypox, you can actually get the vaccine after exposure as well. And the high risk people, of course, are men who have sex with men. But anyone who lives in a community where there are a fair number of cases, in our state here, we're starting to go up. People who work with monkeypox patients or work in a facility where testing is done, and anyone else who might be traveling to an area where there's a lot of monkeypox.
So you can get it after you're exposed, and it'll
Yes,
still work?
and that's what's different about this one. Yeah, so you have about 4 days after exposure to go and get vaccinated for peak efficacy or peak protection. But even after 4 days, in that 4 to 14 day window, if you go and get vaccinated even after exposure, we think that the intensity of your symptoms and the duration of your symptoms will actually be less.
Well, that is key. That's good to know. Yeah. So school is starting. Lots of kids going back to school, obviously, and vaccinations are always brought up then. Is this one that kids maybe should get?
It's a little bit tricky. So young kids, I'm not so worried about because you have to have prolonged close contact. You really have to come into contact from skin, broken skin, the rash itself, which I would suspect if a kid has a rash in a school, the parents will keep him home or the nurse will send him home.
Right.
But the older kids, the adolescents, the teenagers, and the college age kids who may be sexually active, and we know that it's transmitted through close intimate contact, them I'm a little bit more worried about. So I would say talk to your child, kind of talk to them about their behaviors, educate them about how it's spread. And if they have a high-risk condition or you think they're high risk for exposure, you do want to talk to their pediatrician. Now, the vaccine is not FDA approved for less than 18, but it is given in sort of a compassionate use for anyone who's been exposed who's under the age of 18.
So if you show up with a rash and you're not sure what it is, can you get tested for this? Is it like COVID, kind of?
Yes, it is. You can and you should.
Okay.
And other things like chickenpox or herpes or other types of infections, hand, foot, mouth, especially in kids, can look like the same sort of rash. So what they do is they actually cut off the top of the pimple, they unroof the vesicle, so to speak, take a Q-tip and swab the base of that lesion, and then they send that for PCR testing. And it's only 5 labs from the state and a few commercial labs that are actually testing for this.
Okay. All good information. Dr. Kohli, always good to see you. Thanks for coming by.
Good to see you.
Okay.